The bedside nurse notices a decline in patient vitals and presses the code blue alarm button. The PICU team rushes to the room, responding to the code blue. The bedside nurse updates the code team leader, usually the fellow. The charge nurse controls the amount of personnel in the room. The RT begins to manually ventilate the patient. The code team leader is assisted by the attending to update the team and share the mental model, as the charge nurse continues to manage the responding personnel from outside the room. The nurse practitioner, as the CPR coach, manages the defibrillator to identify shockable rhythms and provide CPR feedback to the compressors, who are performing chest compressions on the patient. The code team leader assists with rhythm identification, drug administration, and additional orders to help determine the cause of the cardiac arrest. If the cardiac arrest continues, eCPR is activated by the PICU attending while high-quality CPR continues. The charge nurse calls the ECMO and surgery teams to come to the bedside. The code team leader informs the team that the surgery team is on their way, and it is time to prepare the room. As room preparation begins, the nurses and respiratory therapists ensure there are no accidental disconnections as CPR continues. The team rotates the bed into place for the surgery team to have proper access. The surgery team arrives and gets in place at the head of the bed. As the ECMO team arrives, they set up the ECMO pump system on the right side of the bed. The pharmacy team hands off the ECMO medication to the team. The resource or charge nurse directs the team preparing for a sterile environment as the crash cart moves in. The ECMO team continues to set up their equipment, and the surgery team finishes preparations and begins the procedure. The surgery team coordinates with the code team leader and CPR coach to pause compressions for short intervals for the placement of the cannulas. The surgery team communicates when the cannulas are in position and ready to connect to the ECMO circuit. At the surgeon's direction, the ECMO team activates the ECMO.